Well, new this morning, depression affects nearly 10% of U.S. adults in this country. And with recent economic changes and stresses on the job, depression is common. Dr. Shalini Varma is a psychiatrist at Wheaton Franciscan St. Joseph. She's here to talk about the signs, the symptoms, and why it is that we're seeing more cases. Thanks for being here.
Nice to be here today. Let's
first talk about depression, because I think a lot of people don't recognize exactly what it is.
Depression is actually a very serious illness. There's a 15% suicide rate for patients who have depression. So it's very important to treat it early, get the right appropriate care, go to a psychiatrist, go to a therapist, because just the rates of death are very high with depression.
Why don't people go and seek help?
A lot of times people don't seek help because I think they don't know that there is treatment out there. They also might feel ashamed of their symptoms. They might feel embarrassed of it. 92% of African American males actually don't even try to seek help for their depression.
Wow. And with the economy and the ups and the downs, you're seeing more cases of people with signs of depression.
Right. Actually, in my practice, I've seen increased cases of people who are unemployed and people who are retired. And unemployed people are feeling more and more hopeless as the economy, as they're not able to get a job, as the things are getting more expensive for them to buy, and houses are being foreclosed upon. And retired people who thought they could retire and move perhaps to somewhere warmer aren't able to sell their house, and the investments they made for retirement aren't coming to fruition.
Let's talk about some of the signs. First of all, sadness, anxiety, empty feelings.
Those are the first symptoms usually of depression, where people they even have described it as feeling hollow, where they don't feel the way they used to feel.
Lack of energy, loss of interest in things that they used to enjoy.
Right. These are people who used to enjoy many different hobbies, running, knitting, spending time with their family, and now they're unable to do that.
Insomnia for some, oversleeping for others.
Right, and either way, whether they sleep too little or sleep too much, they still don't have much energy at all.
And this one is the one that's interesting, chronic aches and pains that don't respond to treatment. So there is a real physical component to it as well. There can be.
Yes, there is. There is a physical component to it that can be treated with certain antidepressants that are specifically made for people who have depression problems, as well as these chronic aches and pains.
When you talk about antidepressants, is that the only treatment that's available? Because I think for a lot of people, when you, especially you think of African American men, there's this stigma of taking prescribed medications, like there's something that's not adequate in me. How do you get beyond that, and is that the only treatment that's available?
Well, to get beyond the stigma of antidepressants with patients, I do tell them that depression is largely hereditary, as well as due to environmental factors. So just because they're depressed isn't necessarily their fault. And they have a chemical imbalance that can be fixed with medications that luckily we have in this day and age that have fewer side effects than the older medications.
You take vitamins, you can take this and perhaps find some relief.
Exactly, and I tell people, just like your diabetes medications, just like your blood pressure medications, you need to take this every day, exactly the same way. The other treatments we do have, though, which are available, especially for people who have more mild depression, where they're not suicidal, is therapy. Therapy is great. You can do it either with medications or without. Most of my patients, if they're able to, do both together, and they can work through a lot of these problems they're having.
Dr. Varma, thank you so much. And if some of those symptoms sound familiar to you, speak with your doctor, and you can get help there. But again, talk to someone about what you're feeling. That's the first step to getting some help.